Good morning. Good morning. Welcome to the original Loretta Brown Show radio to open the heart, heal the soul, awaken the consciousness. It's sunny in Seattle this morning. Mr. Benny Mathers.
Hello. Sunny in Seattle. We don't get to say that too often.
No, we don't.
I mean, okay, everyone thinks that, but I think we have a lot of cloudiness, but it's not terrible.
You know, I live here because I'm moody.
Oh, there we go. You just came out and say it, right?
Yeah, exactly. And of course, we had the time change.
Mm-hmm.
Do you like the time change? Or
I've never really, I've adjusted to it for all these years. It really doesn't bother me that much. I think when we were younger, probably because we're kids and we're always grumpy about like we're losing an hour or getting an hour. Because my boys, they were like, we loved it. We got a whole nother hour of game playing. I say loose game playing, which means no sleep extra, which they should because it's fall, right? But yeah, other than that, it doesn't bother me. We'll see what happens in the future.
Yeah. Mm-hmm. And I would remiss if I didn't say, hey, the presidential elections happened.
Yeah, there was a lot of shakeup here this week, Loretta. Right? I mean, just putting it out there, turning it around there. Okay.
Yep.
But I will say, go ahead.
Yeah. No, go ahead.
I was just going to say, thank you for everyone for just voting in general. Yes. A larger turnout than usual, and early voting was way up for Washington State this year, which was a good thing, and other areas surrounding. So kudos to everyone who participated. And I really just say, if you got something to say, well, you got to vote about it. If you got something to say and you don't vote, then don't talk to me. All I gotta say. That's it, really.
I'm like high-fiving you. Boing,
oh yeah,
right, like
right there.
High five.
Give me right there.
Yeah, you got it.
Oh wait,
okay, maybe it's this way.
We gotta work on this camera thing here. Okay. Oh, there we go. I got it. Wait, go there.
Okay.
We need to work on that. Post-production. We'll work on that pre-production.
Yeah, we'll get together and figure that out because that was really good. Totally. I've seen people do that kind of stuff, and I think it's really cute. Anyway, yeah, for sure. I'm a firm believer that one of the freedoms in our country is the freedom of speech.
Correct.
Or we have the right to vote.
Correct.
And I'm with you. If you voted and you didn't like it, now you can say something. If you voted and you do like it, you can say something. And I'm with you. If you didn't vote, I send you, some kind of love. But on the other hand,
some spiritual healing.
Not voting is voting, by the way. That's my I hope I'm not upsetting everybody, but you can go get your coffee because this is going to be a little bit of a triggering show today. I'm just going to tell you right up front.
All right.
And some people are not going to like it. And some people are going to say, wow, I'm glad she's finally bringing that out. So I do want to say this, though, because some people this morning are grieving, some are celebrating, some are confused. And do what you can to not be pulled into any collective hate and fear. And instead, stand your ground, come on in and do what you can to help change the direction of our world. I ran across this really, really great poem from Shalane Harkin, and I'm actually going to take the time to read it. It says, when the earth shakes and foundations crumble, then our light is called to rise up. It's when everything falls away and shakes us to the core and awakens all of our hidden ghosts that we dig deeper to find once inaccessible strength. It's in times when division is fierce that we must reach for each other and hold each other much, much tighter. Do not fall away now. This is the time to rise. Your light is being summoned and your integrity is being tested, that it may stand more tall. When everything collapses, we must find within us that which is indomitable. Rise and find the strength in your heart. Rise and find the strength in each other and burn through your devastation. Make it your fuel. Bring forth your light. Now is not the time to be afraid of the dark. So I send love to everybody. I send support and stability. Let's stabilize. And no matter who you voted for, I want to just remind you of a couple of things. And then I want to bring my guests in. We have a lot to talk about. This is a time of change. Not only is the USA in its Pluto return, bringing astrology to our skies that we haven't seen since the American and French Revolution, But on November 19, Pluto, the lord of the underworld and death, moves into Aquarius and out of Capricorn, where it has been since 2008. This is really, really big. Pluto is a very slow moving planet. It spends around 20 years plus or minus a bit in each sign. And when Pluto moves out of a sign, it always causes destruction. At the same time, it's moving into creation. So back in 2008, you can think what was happening. Well, we had the housing market and all of that. And Capricorn is a very different, or Aquarius, a very different energy than Capricorn, which is all about tearing down structures and corrupt structures. Pluto in Aquarius, the key word is the only constant is change. So it's air. It can be a bit destabilizing as we are taking a look at things that are no longer appropriate or viable to our existence on planet Earth, and taking a look at new ideas, new technologies, and maybe even pulling the veil off our head a little bit to find out what is going on. Some of the key words of Aquarius: the age of Aquarius, we the people, and we are here to work together. So in that energy, I'm going to bring on my guests. I have excellent guests today. I'm going to welcome Dr. Brian Hooker and Polly Tommey, two prominent advocates in the movement to uncover and discuss vaccine injuries. Dr. Hooker is a professor of biology at Simpson University and chief scientific researcher for Children's Health Defense, where he hosts the podcast Doctors and Scientists. Known for his extensive research on the physiological impacts of vaccines, he also speaks to the health differences observed between vaccinated and unvaccinated individuals. Dr. Hooker's own journey as a father to a son with autism, which I believe was a vaccine injury, you'll clear that up with me, drives his commitment to informed health choices and transparency. Dr. Hooker's book, co-authored with Robert F. Kennedy Jr., Vax, Unvax, Let the Science Speak, is based on over 60 studies in the peer-reviewed literature that consider vaccinated versus unvaccinated populations. And joining him and us is Polly Tommey, the founder of the Autism File and the Autism Trust. She is a tireless journalist. Well, maybe she gets tired once in a while. I don't know. She'll let us know. And an advocate for vaccine-injured individuals. Polly has interviewed countless parents across the globe, recording stories of families affected by vaccines and their struggles with injuries ranging from paralysis to long-term health complications. As a producer of the new film Vaxxed III, Authorized to Kill, released nationwide on September 18th, and now available for free streaming on chd.tv, Polly brings firsthand testimonies of families affected by the COVID-19 vaccinations. Jonathan and Polly Tommey's eldest son, Billy, is also a vax injury, if I understand correctly, diagnosed with severe autism at the age of 2, and today is a high-functioning individual. So we're going to shed some light today on a very critical issue, and I hope you will listen closely, listen with an open mind. This is about our health. This is about us. And I'm going to say this too, that the movie Vaxxed III was produced to educate the public on the medical and pharmaceutical malpractice initiated by the US government during and post-pandemic that resulted in bodily harm and in many instances death. Through their efforts, they are bringing increased attention and exposing the harm inflicted by these mandates. And Vaxxed III is the third in the Vax series, so we want to know more about that. And this is a film for the people, by the people. Welcome to my show today, Polly and Brian. It's great to have you.
Thank you for having us.
Yeah.
Thank you.
I'm like wanting, I want to know some history here, like how to, because this is Vaxxed III, maybe we need to back up in time a little bit and maybe just share a bit of your own personal stories. Yeah. And you can just jump in there. I know you guys know each other and apparently you get along okay.
Oh yeah, we work together.
We work together, absolutely.
Yeah.
We have a similar story, like same story of many around the world. I mean, countless really. I was pro-vax, vaccinated my daughter, who is my first child, didn't question it. Why would you question someone who's got a medical degree? Was first into the doctor's office when my son was due his MMR 28 years ago. I mean, that's all that was on the schedule back then. He was a little bit coldy, had a bit of an ear infection and stuff, but they assured me it was fine. We gave him the MMR, which is the measles, mumps, and rubella shot. And by that evening, he was having a very severe seizure. We rushed him to hospital, where the hospital medical staff told us that it was a very common reaction, nothing to worry about. Seizures are common when you take the MMR vaccine. And in fact, if you look at the insert today, you will see that it's in bold writing in there that seizures are a common side effect. And they told us that Billy would be fine. They gave him antibiotics, but he's, 28 years on, he is not fine. He's not high functioning. He is will never live independently, drive a car, get married, or any of the things that 28-year-olds should do. He lives with us. We do the best we can to give him a life. But the reason why I'm so passionate about this is because I don't want anybody else ever to experience vaccine injury, because it is hell on earth. And anyone who says that autism or whatever diagnosis they give vaccine injury is a gift, it is not a gift. My son is the gift. The injury is not. So that's where my passion comes from.
Wow, thank you for that. Yeah, and Brian, if you want to share a little bit about your journey.
Absolutely.
Yeah.
Very similar to Polly. I was very pro-vaccine. I actually grew up in a family where my mom was a public health nurse down in Southern California, and was in charge of distribution of vaccines through the clinics, in a very large county. And so I was, surrounded by material, but even with all that material, I didn't really ever realize that vaccine injury was a thing, that it actually existed. To me, it was, somewhere else, 1 in a million. And very similarly, my son had an ear infection when he went in for his 15-month vaccines. He got the Hib vaccine, the DTaP, and then the oral polio vaccine. So he was receiving mercury and live viruses all while he had an active ear infection. And he very, very quickly developed a fever. We treated the fever with Tylenol, and then within 3 months, he regressed into full-blown autism. He was diagnosed at his next well baby checkup at 18 months, and he lost all language. He lost all eye contact. His GI tract just went ballistic. I mean, there's no other term for it. Medically, he was, all of a sudden, he was extremely challenged. And so it was very plain that it was the vaccines. Steve is now 26 years old. He is very similar to Billy. He's not high functioning. He needs 24-hour care, consistent 24-hour care from my wife and myself and our helpers. And so, no, this isn't a lifestyle. I mean, Polly said it very eloquently. My son's a gift. Autism is not. Autism is a scourge. Most people who get that diagnosis, who actually have that diagnosis, will not live independently.
Wow. My heart really goes out to you, and also to all of the people listening who may have had similar stories. And I have to tell you, I'm of an era where we went to school and stood in line. It was the day to get your shots, right? The day to take your polio, eat your cube, your sugar cube, right? And nobody ever talked about vaccine injuries, and why would you? Like you said, you're just like, okay, well, this is what we do, right? Yeah. So back up a little bit and talk about Vax One, right? Let's talk about the movie and how that came about, and also what happened when you put out the first movie. Because Brian, were you both involved in that first movie? Okay.
Yes, we were both involved in the first movie. Vax One essentially tells a story about a whistleblower from the CDC, and how using the information from that whistleblower, then we were able to uncover the fact that the CDC had committed fraud regarding vaccines and autism, specifically the MMR vaccine and autism, and then also thimerosal or mercury-containing vaccines and autism. And so I was very fortunate to work with Polly Del Bigtree and Andy Whitefield regarding the movie Vaxxed. And, it tells the story of the whistleblower. The whistleblower finally came out and made a public statement about the fraud in August of 2014. And I had recorded phone conversations where he said he was complicit in the autism epidemic. And so, with this electrifying information, then Polly, Andy, and Del then set out to make Vaxxed.
You made Vaxxed, and then I think it got banned, didn't it? What, could you talk about that, please?
Oh, yeah, we were going to Tribeca Film Festival, and Robert De Niro had helped us enormously back then to do that. And then it was pulled very, very suddenly, just pulled from the Tribeca Film Festival, with a lot of press associated with it, saying, nobody must see this film. It's dangerous. We don't want to be part of it. And it backfired on them because, of course, when you tell people not to see something, the first thing they want to do is see why they shouldn't be seeing something. And so #Vaxxed went viral. And we were so disappointed when we were thrown out, but then it just took another turn and took us to another level. And I think they learned from that, because when we came to do Vaxxed II, they gave us no press. They were silent on it. And with Vaxxed III, it was to another level. They actually said that Vaxxed III was a dangerous movie. Before we'd even made the movie, they said it was dangerous. So it's interesting how they are desperate for Vaxxed 1, 2, and 3 not to get out to the public. They do not want you to watch these films.
I'll just ask the obvious question. Why? Why should we not see it? Why should we not watch these movies? Because now we're all going to go watch them, right?
I think Brian should answer that.
Well, that is, the big message from the medical establishment and the pharmaceutical industry is that this is fake news, this is misinformation, and somehow we're, making all of this information up, that it didn't really happen this way. But I challenge people to, even if you're on that side, you should watch the movie. You should see it, because you should see these individual stories. We have a story in Vaxxed 1 of an African-American boy that received by mistake, two MMR vaccines in the same doctor's office visit. And then essentially from that moment on was autistic. And so you see these very, very powerful stories, and all these anecdotes add up. And, I'm a scientist. And so I take all of this information, roll it up, and that's how you get science. These are called case studies or case series. And but the medical establishment was this was verboten, that you do not talk about this, you do not see this, and if you do hear about it, then you roundly condemn the people. It got to the point when Vaxxed 1 first came out that I thought my first name was debunked, because whenever they quoted me in the press, it was in CNN, it was in ABC News, I was always the debunked scientist, Dr. Brian Hooker.
Yeah, go ahead.
I just want to say also that it's really interesting how they call us the anti-vaccine, Children's Health Defense, the anti-vax group. Vaxxed 1, Vaxxed 2, Vaxxed 3, the anti-vax or films. Everybody in the film vaccinated. That's why we are there. We are there because we did vaccinate. So how on earth does that make us anti-vaxxers? I even went on to have another child and vaccinated that child, even after my second child, Billy, was injured, because I thought it was just the MMR. I trusted them so much. I mean, who wants polio, right? So I vaccinated my third child as well, because I believed so much in the system. So I find it really disgusting that they scream anti-vaxxers at me, Brian, but also the parents who have lost babies. We have so many babies that have died, and they call it SIDS, following vaccinations. And they scream at these mothers who are suffering and they have no voice out there. You are anti-vaxxers. They've just lost a child from vaccinations. We're not anti-vaxxers. We are ex-vaxxers.
Yeah, that's a good thing. And I'm also thinking while you're talking that there's so much confusion. Like, who do we believe? This science or this person or that person? And as a mother who also vaxxed, right? Because I'm of that era and my kids are vaxxed, right? I was vaxxed, the whole thing. We're at a time where people are confused. They don't know. Should we do this? Should we not do this? Right. Dr. Hooker, I want to ask you a question, maybe both of you. I don't really know how to answer this question, but are there any physiological mechanisms that lead some individuals to be to have more severe vaccine reaction? Like, is it predictable? Is it unpredictable? Yeah, can you talk about
That's a
that a little bit?
really good question. And, I wish more people would answer that question. We did sort of backwards the genetic analysis for my own son and saw that he could not tolerate the heavy metal contaminants, mercury and aluminum in vaccines, and he could not handle detoxifying those. Neither could he handle, his immune system was so hyper triggered that he would go into what was called cytokine storm during, and that's what caused the neuroinflammation. That is what caused the brain inflammation. And so you can determine that very easily from very, very rudimentary genetic tests that are done all the time. And so you can see that even there were just a handful of vaccines compared to the bloated vaccination schedule now that my son received. But even with that handful of vaccines, he should have never received any day one. And that can be predicted. But I do want to add a caveat, and that is that the vaccination schedule now is so bloated that children are receiving about 30 needle sticks through their first birthday, 8 needle sticks at 6 months. I mean, it's absolutely incredible what their immune systems are having to go through at this particular point in time. And so given that, I would not recommend the vaccination schedule for anyone. Really would not. It is just has never been tested together. It is not safe. I always get the question, well, which vaccines are safe? Well, none of them have been tested against inert placebos. And so you cannot say that they're safe.
Wow, I'm mind blown, right? Like, I don't have little babies right now or little kids, and I don't have little grandkids, and I'm like, I don't know who could stand up to that sort of thing.
Like, it's really, it is astounding. The advisory committee for immunization practices, they work with the CDC and they determine what goes on the vaccination schedule. It's interesting that they've never pulled anything off of the schedule, but they always add more and more and more. And we will be upwards to 100 needle sticks through the 18th birthday on that vaccination schedule in short order, because you look at the vaccine pipeline in pharmaceutical industries, this is where they're making money with no liability.
Yeah, making money with no liability. Okay, that's a really big statement. Um, you know, I was like trying to figure out where to go from here. If I was listening to this as a parent, I think I'd be catching my breath and holding my breath, going, well, then how do I go from vaxxed to ex-vaxxed, or and maybe I'm jumping ahead here because I do want to cover more information from your movies, but how do we just say no? And like you said, I mean, I went along with things because I'm like, I don't want my kids to get polio. I don't want
Right.
MMR, even with COVID. People are like, well, I don't want to get COVID. I want to throw this out there and then have you respond. I actually had someone contact me a while back who's like, everybody's at school, I'm going to paraphrase here, is getting COVID. Should I have my kids get another booster? Like, somehow getting that means they're not going to get COVID. And yet we know people that got boosted got COVID, right? So that was a lot.
People that got boosters and then died. So yes, there's that.
Absolutely. Go ahead, Polly.
I just want to, I feel that, I don't know your listeners, but if they're people like I used to be that vaccinate their children and that, I mean, until my son had an injury, my child was fine. Or so I thought, everyone was fine. They had their vaccines and they were a little bit sick for a bit and then they were fine. I think the thing to realize is that we kind of live in fear, and whether we admit that or not is another thing. But you've got the news always telling you, let's take measles. If your child gets measles, it's going to die. Millions of people, apparently, this is the news talking, have died, and it's in Disneyland, or it's very near you right now, and your child could die. Nobody wants their child to die. So you trust the doctors. Why would you not? You go along and get something to prevent your child from getting really, really sick and potentially dying. And so you're bought into all of this. I was too. So was Brian. So was 99% of the people that vaccinate. But we've got to take a step back and think for ourselves, take back control of that. When I was young, 50 odd years ago, when I was little, we got measles. We would go to parties. They were known as mild childhood illnesses. And so the fact when we would go to these parties and suck these little lollipop things and try and pass them around and try and catch the measles or the chicken pox or whatever it is, we were mumps. And our parents would be disappointed if we didn't catch it, because it meant they had to take us back out again to another party and try and catch it. And then even when the whole family got measles, mumps, whatever it is, the doctor didn't even come and see you because it was a mild childhood illness. Now we've gone from that 50 years ago to everybody be very, very afraid and stick as many needles into your child as you can. And for those that are listening that think, like I used to do, that, well, it's just a little bit of potentially a bit of water, a bit of salt maybe, and a little bit of measles, mumps, and rubella, just a tad into your child's arm and everything will be fine. It's not like that, is it, Dr. Hooker?
No, it's not like that at all. If you look at the measles, mumps, rubella vaccine, it actually has over 10 times the amount of virus that's ever been tested for safety. I mean, they increased the virus concentration in 1999, and we see a corresponding uptick in adverse events when they did that. And this has never, ever been safety tested. So you look at these, we talk to people that say, oh, well, I'll just space them out. I'll just give them one at a time. And it only takes one. It really only takes one. And you look at these lack of necessity for these vaccines, the fact that most of them, if not all, the mortality before the vaccine was introduced was effectively nil, then what we're buying into is a grand lie by the pharmaceutical industry, basically to make a significant amount of money. If you look at the money that was made, especially for the COVID-19 vaccine, over $150 billion in sales for Pfizer and Moderna. It's big business. It is big money, and they're sacrificing our kids sort of at this altar.
That's right.
Wow, those are staggering numbers. We're actually going to take a station break, and don't go. I'm riveted. I want lots more information. I have 54 questions. We won't get to them. My guests today are Dr. Brian Hooker and Polly Tommey. We are talking about vaccinations, obviously, and vaccine injuries. And I think there's a lot of information that many people have been asking. You need to have some information, and so you can make a correct choice. And this is Loretta Brown. We're going to take a little station break. Don't go away. We'll be right back.
All right. All clear. Energy is powerful. It's all around us, mysterious, full of potential. Directing positive, healing energy to raise your vibrational rate through Reiki can change your life. Reiki Master Loretta Brown has relieved stress, sadness, anger, and even helped clients lose weight, stop smoking, and end sleep disorders. Worldwide, people have sought out Reiki Oasis. If you want help with your dis-ease, visit ReikiOasis.com. Harness life's energy. Visit ReikiOasis.com today.
As a teacher, I should know the answers, but with Crohn's disease or ulcerative colitis, answers don't come easy. Steroids made my gut feel better, but they brought symptoms and risks of their own. A friend told me about the Crohn's and Colitis Foundation, and they helped me find a specialist. We talked through the pros and cons and landed on a new treatment. I feel like the guy with answers again. Don't wait. Make sure you have the latest info and the best plan for you. Spill your guts. Learn more at spillyourguts.org.
Alternative Talk 1150 is your sports organization's safe bet when it comes to airing your team's games. Our players are all seasoned professionals when it comes to sports programming. Imagine your games being heard on local radio. Your team deserves the MVP treatment. Call 425-653-1150 today to learn how affordable and fun it is to broadcast your games on the radio. Call 425-653-1150 and make your next season something special. That's 425-653-1150.
Broaden your horizons. You'll be amazed at all the topics we cover on Alternative Talk 1150.
Y'all ready to come back? All right, stand by.
Welcome back to the original Loretta Brown Show, and with my guests, Brian Hooker and Polly Tommey, and we're talking about vaccinations, vaccine injuries, and all of those things. I want to remind people that these shows are archived, downloaded for free at the 1150 AM KKNW archives for the original Loretta Brown Show. And we're also everywhere. We're on iTunes, Podcast One, Spotify, X, Megaphone, YouTube, Audible. I think it's everywhere, but please go and also check out connect with them. You can watch the movie Vaxxed III at chd.tv for free. And
Vaxxed II as well. Vaxxed II is free on there as well.
Okay, good. Yeah, I highly recommend it. Please go. It's sobering, but I think we need to just take a look at it. Like I was saying earlier, it's time to pull back the curtain and see what's going on behind there, right? Pull back the carpet, take a look. I want to ask both of you, and you've gone all over the place. You've gone all, like this latest movie, Vaxxed III, and maybe in the other ones, you've interviewed all kinds of people. You've heard all kinds of stories. I think you even have a bus. I don't know how many signatures are on it. I want you to talk about that. But what are some of the most interesting or surprising stories that you have run across?
Well, we're on our second bus. The first bus is full, has over 10,000 names on it, and we can't write anything else on it. And so this is the second bus, the Children's Health Defense bus, and it has around 2,000 names on it. We were going to travel for the whole year, but the stories were so coming thick and fast, so much death, that we came back early to make this movie so that we could get the information out to people as the winter came in. Because we did experience something which we weren't expecting, which was the hospital protocol deaths. So people would come and tell us that they would take their loved one into hospital during the COVID era and they would not come back out again. So they would be put on ventilation and in their words, killed in the hospital. So this was something that we weren't. I mean, we are sort of, from the previous films and everything we've done, very much into recording vaccine injury and death. And suddenly all of these hospital protocol deaths were coming at us. And it does fit in because we did find out that the unvaccinated were targeted as they came into hospital during the COVID era. So yeah, Brian probably can talk more about that.
It was interesting because Polly took the bus out on the road, started on tour in Texas, and then went up through Kansas. And just a few days into the tour, she would call back and she would talk to our president, Mary Holland. She would talk to me about these hospital protocols. And we expected to hear about vaccine injuries from COVID-19 vaccines, but we did not expect to hear what we heard about the hospital protocols that were basically killing protocols for people going into hospital during the COVID era. And they were the unvaccinated. One of the things that was happening was that people were asked when they went into the hospital, regardless what it was for, if they received the COVID-19 vaccine. Those individuals were treated differently. They were discriminated against. And it was almost from a programmatic perspective that they had the target on their backs because you know what? nationwide, that was going to be the message, was that this is the pandemic of the unvaccinated. This is going to be death for the unvaccinated. And so the henchmen that were fulfilling this prophecy were actually the medical workers at the hospitals that were getting reimbursed for protocols that were not effective, that were essentially killing machines. And so when Polly told us these stories, we're like, wait a minute, wait, you know, let's collect some more stories before we actually go out with this, because it was just unbelievable.
Yeah, it's horrifying. It's actually horrifying. I do want you to talk more about that. Like, how were they being treated? And yeah, this target on the back, the money. Yeah, please
Exactly.
tell more. Yeah.
Well, I mean, I can just, but Brian can talk about the
Yeah.
money, but I want to make it clear that we interviewed people, a lot of people who were injured by the COVID shot as well. And a lot of people who were reporting death following, particularly Moderna and Pfizer. We didn't hear so much of the Johnson & Johnson, but what we did hear with Johnson & Johnson was more psychological issues occurring from that shot, which was something new. We didn't expect that people were experiencing bad thinking and being diagnosed with sort of schizophrenia type issues. That's what we got from a Johnson & Johnson. Moderna and Pfizer, severe injuries and a lot of death. But they would also talk about when they went to hospital during COVID with the Moderna or Pfizer injury, they were not given the treatment that the unvaccinated COVID people were given. So we want to make that really, really clear. This isn't coming from Brian and I. This is coming from the people of America telling us these stories. So we knew when that we had to get another bus, because we could hear on the mainstream news, they were saying it was a pandemic of the unvaccinated were killing granny. So we knew we had to get out on the road and find out for ourselves what was going on, because we knew that didn't make sense. And now,
Whoops.
We lost your sound, Polly.
Your sound just went away, Polly.
Oopsie.
Am I
don't know
here?
why
Oh, there
it's-
she's
You're
back.
back. You're
You're
back.
back. Okay.
Yeah.
Oh my, that must be gremlins getting involved there. That's weird. But basically just saying that, yes, there's 100% a difference in treatment for those that took the shot and those that didn't in hospital.
Right. Those that took the shot, you know, according to the narrative, were the ones that would survive. And those that didn't take the shot, of course, you know, they were bad people. They were killing granny. They were selfish. They were looking out for their own purposes. They weren't doing the greater good. They were bad Christians, or, you know, reprobates. And so when they would go into hospital, they would be tested repeatedly, whether they had COVID or not, until they would get a positive PCR test. And, you know, we know from the press and the news that the PCR test could be manipulated, and people without COVID symptoms, you know, as well as those that did perhaps have COVID-19, if they were unvaccinated, then they were automatically put on remdesivir. Remdesivir carries a premium. The hospitals would make more money. They would make about 100% more money for a patient on remdesivir than a patient that wasn't on remdesivir. Remdesivir in clinical trials failed the Ebola trial because it was killing so many people within that clinical trial. The reason why remdesivir was chosen as the drug that was going to treat COVID-19 was because it was on patent, and it was developed using technology in Tony Fauci's organization, the National Institutes for Allergies and Infectious Diseases. And those researchers received millions of dollars over the pandemic, directly received royalties for remdesivir through the parent company, Gilead Sciences, that had marketed the drug. And with all of these hospital protocols, then they were getting rich as people were having organ failure. This remdesivir is bad for the kidneys. It's bad for the liver. It causes organ failure. So consequently, on remdesivir, the patient's then lungs would fill up with fluid as they were in kidney failure. And in order to get rid of that fluid, they were intubated, and then they were put on mechanical ventilation, which carried another cost premium, another price premium. And then finally, they would go into intensive care, because it is not appropriate for patients to be put on mechanical ventilation that dries out the lungs, causes lung disorders, over that long period of time, and then eventually then they would terminate. Those that we resisted, Polly can tell you this firsthand from the stories, those that resisted then were put on a cocktail of drugs, of narcotics, like morphine, like propofol, like fentanyl, and they would essentially then, if that patient still was resisting, put them on 4-point restraints.
I'm sorry, I'm horrified. It's
It
barbaric.
there's no other word
It,
for it. It was actually horrific. And then the story over and over and over again, unless those individuals were able to get out of the hospital, they would terminate. They would die on that protocol.
It must be really hard for your viewers to be listening to this right now, because when I started hearing these stories, I just thought, well, to start with, maybe that was just one off, maybe just a couple had this, but it was everywhere we went. These people, and we didn't know these people. All these people knew was there was a bus coming to town. Most of them had never even heard of children's health events,
Right.
and that they could go and tell their story of what happened during COVID, and the lines were huge. And they were all saying the same thing. They took the shot, they were injured or died. They went to hospital, injured or died. It just went on and on and on. And then we started interviewing people who didn't take the shot and didn't go to hospital. And there was no myocarditis, no pericarditis, none of the symptoms we saw in the vaccinated for COVID, none of them in the people who didn't take the shot. It was just, it's plain as anything, isn't it, Brian? I mean, the science, as you say, it's just there.
It's very plain, and the science is there showing that the repeated boosting that people are getting actually make them more susceptible to viral infections, to COVID-19, not to mention all of the cardiac damage, all the circulatory damage, and all the neurological damage that's happening due, primarily to the spike protein. If you look at the vaccine, they took the most toxic part of the virus, which is the spike protein that does damage to human cells, and it does activate autoimmunity and the immune system to start attacking human cells. It makes perfect sense that this would happen. They took the most toxic part of the virus, and then they injected it over 13 billion times worldwide to people.
wow. It raises a lot of questions as to you're talking about vaccine injuries pre-COVID, and you're also talking
Right.
about the COVID vaccines themselves and the things that have come out of that. And like I said, this is probably difficult for people to hear, but I think we need to just take a look at it. Seems to have been driven by money, money, that bottom line thing. And I want to pull a piece out because we have something called informed consent. When you go to get medical care, you sign for the care. Can you talk about that a little bit? Yeah.
Absolutely. You're giving informed consent for a product that under emergency use authorization, then you're basically participating in a medical experiment, because really the clinical trials were not done. In fact, for some of these products, they extend out to 2026. And so, when you're giving informed consent under emergency use authorization, then that heightens the risk. There is more risk with these products because they have not cleared a FDA clinical trial. They've just gone through, say, the first stages, the first hoops. And there were no long-term studies on what was going to happen to these individuals. The longest individual that was followed in the original Pfizer clinical trial was followed for 14 weeks post-vaccination. 14 weeks, that's it. And so they had no idea what was going to happen in long-term studies. And literally, you would pull out the packet insert from the vaccine, and it was completely blank. It was blank. And Pfizer then fought tooth and nail to take the clinical trial data, to take the actual information and bury it for 76 years. They did not want to release it for 76 years. Then it took a federal judge actually ordering Pfizer to release the information from the clinical trials, and to show the fact that after the vaccine was released, within 3 months, there were over 1,200 deaths that Pfizer recorded themselves associated with the vaccine, 1,200 deaths in the first 3 months after the vaccine was released. So, it was death all the way. It was carnage all the way. There are people that are going to have long-term damage for the rest of their lives because of the COVID-19 vaccine. And, people walked directly into that, with a huge amount of misinformation given through the mainstream media about the effectiveness of the vaccine, about how you were not going to transmit the virus, how you were not going to kill granny. And, again, that this was the appropriate societal thing to do.
Yes, absolutely. Um, During the break, I think, Polly, you might have mentioned that teenage girls experiencing early menopause, and has there been any effect on pregnancies or the ability to be pregnant or anything like that?
Well, I mean, when we were on the first tour with the first bus, we had so much Gardasil industries. Gardasil is the HPV shot that the doctors push on those teenage girls and boys. In fact, not even teenage now, is it, Brian? It's as young as
Right,
9.
right. It's tweens. It's children as young as 9 years of age are getting the HPV vaccine.
And all we saw was death, a lot of death, a lot of severe injuries, and girls going through the menopause at that age. I mean, and as one mother said, how do you tell your 13-year-old daughter that she will never have children? She has gone through the menopause. So horrific injuries from the HPV Gardasil shot. I would go as far as to say that is the most injurious vaccine that we have out there. But and many will say, no, it's the COVID shot. Maybe it is the COVID shot. But what if we'd mandated the HPV Gardasil shot to the world like they did with the COVID shot? I feel like we have very severe injuries. It's a dreadful shot, dreadful vaccine.
Absolutely. And we saw things that from a menstrual perspective, scientifically, that we had never seen before. There were women that were losing their entire uterine lining, within like 15 minutes. All of a sudden, it was called decidual cast shedding. And we had so many reports of that we did a small scale study, 6,000 women who were taking the COVID vaccine for the first time, and then a control group that did not get the COVID-19 vaccine. And we saw 300 case reports of decidual cast shedding. And it was unlike anything that people had seen before. We thought, okay, well, we'll go back in the literature and we'll see how often this happens. We could only find 100 reported cases in case history over the last 150 years of decidual cast shedding. But yet in our small cohort, it's just happening regularly. So we knew that there were significant menstrual issues that were going on because of the COVID-19 shot.
So for anybody listening to this show, and maybe they're making some dots and maybe their throat's tight, right? Maybe their gut's rolling around. Maybe people are realizing, oh my goodness, maybe, what advice do you have to give them? What can they do? What's your recommendation?
Well, I'll go first, and then you, Brian.
Okay, go ahead, Polly. Sorry.
What I recommend you do is don't panic. So you can't undo a shot that's gone into yourself or your child, but there's a lot you can do to improve the quality of your child's life or your life as well. I recommend you tune into organizations like us. It's free. And we go out daily at 10 o'clock Eastern, and we break down the fake news and bring you the good news. We have doctors on that can talk about, we can't give out medical advice, obviously, but we can help you. And you also, you're with like-minded people that did vaccinate. All of us did. There's no anti-vaxxers there. They're all ex-vaxxers. And they're working out ways of how to improve the quality of life. We were told that Billy would never speak, never live a life with purpose, and really we should just put him in a home and just be done with him. But we didn't. We forged on, and we found that food played a huge part, and that there's no doubt in my mind that food plays a huge part, by the way, and that there were other things that we could do, learning from other parents how to improve that life. So stick with us, with the tribe, but there's other organizations that do similar to us, but find those people, they're out there, and move yourself away from people that are yelling and shouting at you. If you suddenly decide, you know what, I'm not going to give my kids any more vaccines. Watch your friends turn against you, because that's what happens. Well, I mean, why would you be doing that? It makes them nervous. They want you to be the same as them. So just remember, you're in control of your family, of yourself, your body. And so you do the research. You cannot trust doctors that are getting paid to vaccinate. You've got to do that research yourself. And it doesn't mean going to Google or asking your pediatrician. It means getting that insert out of the vaccine and looking for yourself what the manufacturers are telling you are the problems with it and what's going into your body. So you just have to take control and stop. Sadly, you have to stop trusting, because that's what we did. And Brian and I are in this situation because we wholly trusted. You can do it. You're going to be fine. And know there's so many more of us out there than they even want you to believe. There's so many of us out there that are taking this line of we're taking back control.
Thank you for that. I want to insert this too. A few, maybe 2 months ago or so, I interviewed Zen Honeycutt from Moms Across America.
Wonderful.
And she was headed to Washington, D.C. to talk to Robert F. Kennedy Jr., I think, about getting glyphosates out of the foods. And I don't know how many toxins are in our foods, but that's also part of this issue, right?
Oh.
Yeah.
Oh, absolutely. Absolutely. We need, we're ingesting food every day. And so you need to make sure that the right food comes out, that you're consuming, the right food. The GMO revolution in the United States started in 1996. That's when they started using massive amounts of glyphosate on crops, because now these crops were genetically modified so they could tolerate glyphosate. There's also another toxin that's used for insect control that's genetically modified into the cells of the plant, called Bt toxin, and that survives the gut. It does get into the bloodstream. So, say no to GMOs. Say no to GMOs. They are not this panacea of health and of better quality food. No, they just make it easier for individual, companies like Monsanto and Syngenta and ConAgra to sell more pesticides, to sell more herbicides, and to really addict these farmers to these seeds. It's big ag and big food are just as bad as big pharma, and we have so much appreciation for what Zen Honeycutt is doing.
I love Zen.
Yeah, she's great. Yeah, she's great. If you see her, say hi. Say, Loretta says
Absolutely.
hi. She'll go, who? And you just say, remember that woman from Seattle. Anyway, what do you really hope that people get from what you're doing? Final comments and where to find you. And also, I know I asked 6 questions at once because that's how I function. The Children's Health Defense, what is it? Yeah. Okay.
Go ahead, Brian.
Oh, no. Well, if you look at the Children's Health Defense, it is an organization that is committed to the best health of children. And so we're looking at multiple fronts on how we can, take this generation that is, you look at adults in the United States, 60% of them have at least one chronic disease. Over 40% of the children have at least one chronic disease. 1 out of 10 has ADHD or ADD. 1 in 33 has an autism diagnosis. So we want to see that turned around. We want to make sure that we're giving the information that not only can we prevent these chronic illnesses and we can prevent the diseases, but we can remediate those situations where children have been injured, where children have been damaged by these chronic diseases, and we can make them whole again. And, Polly and I work on this every day with our own wonderful special now adult children. And so we want to be able to impart that to the rest of the world.
Wonderful. Any last comments? Any last advice? Any last hope?
Well, I tell you what I think. Well, the Children's Health Defense was set up and organized by Robert F. Kennedy Jr., who is now has a part of sorts in helping us break down why our children are so sick here in America, why there's so much death on the first day of life. So I think we're in good hands. I want to say to your viewers is that there's a lot that we can do. We are the people, and we have much more power than they want you to think that we have. So I would say stand firm stand firm on you, your children. Tune in with us. Keep watching Loretta, listening to Loretta, and tune in to us as well, because we're discussing it very calmly, breaking down the science with Dr. Hooker's amazing science team. We have an amazing legal department as well. And we're really working with great minds to really figure out how we can become a much healthier nation, which is important for the future, because it's not sustainable, the amount of shots that these kids are getting. It is not sustainable, the poison in our food. And so we have to protect the future. And look at all the children like Billy that are out there now. Just walk into a department store and look at the children that are with their parents. They're in either wheelchairs or they're sick. You can hear that autism voice a mile away. They have severe allergies. If you get Dr. Hooker's book, Let the Science Speak, co-authored by Robert F. Kennedy Jr., that in there will tell you the truth about the vaxxed, unvaxxed. Do not be afraid of not vaccinating your child, but just feed them healthily, get that vitamin D on them, get them out in the sun. And listen to us, because we're uncovering so much stuff with amazing scientists around the world about sunscreen, about what's in the air, what's in our food, what's in our water. And we're learning every single day. So come and learn with us.
Yeah. So this is Loretta Brown, and that's our show for today. I hope it was informative and maybe shook you up a little bit so that you'll take a look. And to Dr. Brian Hooker and Polly Tommey, thank you so much for being here. And find them at chd.tv, Vaxxed III, the Children's Health Defense. Years ago, I had a vision quest, and the message was heal the children and you heal the land. There it is. All right. Thank you so much. Benny, you're the best. Bye, everybody.